At an adult education center in Fairfax County, Virginia, a classroom of nursing students is learning what it feels like to experience auditory hallucinations. The classroom buzzes with noise as pairs of students try to talk, while a third student whispers distractingly in one of their ears. The exercise is part of a 12-hour course in mental health first aid, an import from Australia that is now making inroads in the U.S. Just as regular first aid trains citizens to perform CPR and wrap tourniquets to care for the injured until medical professionals can arrive, the idea of mental health first aid is to equip ordinary citizens to identify and help people going through mental health crises, and then direct them to a credentialed mental health professional.
The goal is to make people in the community aware of, one, the stigma that's attached to people with mental health or substance abuse issues, and two is to see those signs and symptoms, be aware of them, and implement that ALGAE action plan.
That's course instructor Pune Zarat. The algae she mentions is not a type of seaweed. It's an acronym for the steps that the course teaches. Assess someone for risk of suicide or harm, listen to them non-judgmentally, give reassurance and information, encourage them to get professional help, and encourage self-care. The course includes lectures, interactive activities, and videos that show how to apply the steps in situations involving substance abuse, depression, anxiety, schizophrenia, and more. This morning, the lesson is on how to deal with someone who is hallucinating.
I'd like to call the crisis team. I think they'd be able to help us out here.
Fairfax County's Community Services Board began offering the course in 2011 and has trained more than 600 people so far, according to the CSB's Jamie McDonald. Some of the classes are open enrollment, while others are for specific groups like these nursing students.
From the very beginning, we had quite a bit of interest and have trained a mix of members of the community from all walks of life. Runs the gamut from the nurses, this nursing program that we're teaching today, as well as folks from our Alcohol and Safety Action Program, from court-appointed special advocates who work with families that are having domestic and kinds of issues. We've trained the campus police at Northern Virginia Community College over at the Annandale campus.
McDonald says that in follow-up surveys, people report using their new knowledge in both work and their personal life.
One person in particular said that a relative had to be hospitalized because of a mental health crisis, and that based on what they'd learned in the class, they were far more confident about interacting with the medical professionals at the hospital and felt they were much more able to advocate and support their relative, and that they just couldn't say enough good things about what they'd learned and how helpful it was.
The county plans to keep offering the classes at least once a month and hopes to soon offer a new version designed specifically for adults who work with kids.
If we could make it as important as CPR and as pretty much want to say mandatory as CPR and first aid is with some of the careers out there, if we could make it like that, that would be wonderful, because it's so needed. I can't emphasize how much it's needed.